The workshop about integrating sexual interventions into couple therapy is by far my favorite workshop about sex therapy and what sex therapy means. And I'm most enthusiastic about giving it. So I'm really looking forward to our all-day workshop. And what we're going to be doing in this all-day workshop is talking about a new model of couple sexuality and why couple sexuality is usually more effective than just general couple therapy or individual therapy. And that's true of both men and women, but especially true of men. And what we'll be doing is talking about a 4-session assessment model. And if at all possible, we'll be talking about doing the first session as a couple. And then if we want to hear the genuine narrative, doing the second and third session as individual psychological, relational, and sexual history. And then having a 90-minute feedback session where we outline what is going well and what is going badly sexually. And usually the most common sex therapy contract is a 6-month good faith effort to create a healthy sexuality and a healthy relationship. And for most people, that is possible, contrary to what people had believed. The other thing that's really important to understand is that what we used to believe is that the whole issue was about arousal and orgasm. As long as arousal and orgasm went well, everything else would go well. And we missed the most crucial issue, and that is responsive sexual desire. So when you're talking about healthy sexuality, you're talking about desire, pleasure, eroticism, and satisfaction. And teaching not just the client to learn that language, but the clinician to learn that language. And also talking about the concept that sex is not about performance, it's primarily about giving and receiving pleasure. And last but not least, we're not going to try to make these the most erotic people in their community. What we're going to try to do is help them integrate 3 very different concepts. And those are intimacy, pleasure, and eroticism. All 3 matter to both males and females. And we'll talk in this workshop both about mainstream couples, but we're also going to talk about sexually alternatives couples. Alternative sexuality needs to be treated as a first-class issue, and helping that couple reach the goal where sex plays that healthy 15 to 20% role in the individual's life and the relationship, rather than a draining, destructive role. So couple sex therapy, more than any other sexual intervention, helps people own their sexuality and express their sexuality in a way that enhances their life, that plays that 15 to 20% healthy role, rather than that destructive, destabilizing role that it plays in so many people who come into your office lives. So I'm really looking forward to seeing you and doing a whole day on couple sex therapy.